Hi, my name is Al. I'm a junior investigator with Pearl.
I'm Prativa. I am not a senior investigator. I'm a deputy director of Pearl.
And welcome to another episode of our Pearl webinar series. Today's guest is the incomparable André Picard, one of Canada's most respected health journalists. He's a health reporter and columnist for the Globe and Mail, where he's been a writer since 1987 and the author of 6 best-selling books. André is a two-time winner of Canada's National Newspaper Awards for columns and a recipient of the prestigious Missioner Award for Public Service Journalism. He's been named Canada's first public health hero and a champion of mental health and received the Queen Elizabeth Award Jubilee Medal for his dedication to improving healthcare. André, it's such a pleasure having you here with us. Thank you so much.
Yeah.
Thank you so much, Andre.
So we just wanted to get started from all of this, right? So you've shaped how Canadians understand crisis for decades. Can you maybe just start by telling us what the biggest misconception public health has about journalism?
I think they think that journalists are out to trick them and to, make them look bad, etc. But the reality is we tend to see ourselves as watchdogs. So we do write largely negative stuff, but we do write a fair bit of positive as well. So I think that watchdog function scares people. They're like, oh, if they come and talk to me, they're coming after me.
Yeah.
But most of the time, that's not the case. And hopefully when we do it is entirely appropriate.
Yeah. And I remember hearing about this before, but I think what that you come face to face with a lot of people who do come after you for what you say. Have you ever experienced any sort of I don't know, I think we were talking about this, lawsuits and things like that. How do you navigate those issues when people are coming after you for your opinion?
Yeah, you get lawsuits. It's sort of part and parcel of the job, especially when it's a big publication like the Globe, and we have lawyers and they take care of that. But we're very rigorous about our fact checking, so I've never lost a lawsuit. That's the important part. I think worse than that these days, since the pandemic, is the threats and the angry mail. I get a lot of it, but I always say, I'm relatively protected from it. I'm an old white guy. My colleagues who are women, people of color, they get really, really abusive stuff. So I'd rather get it myself. I'm used to it. I've been getting it for many, many years. And I think it's much harder on younger journalists. But it is off-putting when, you get your voicemail and somebody says, we're coming to get you and your family, and you got to get the security involved and the police.
Have you felt like this has increased since COVID?
Oh, absolutely. It's night and day. It's very common now. I don't think I write a column without getting some kind of awful email and sometimes a threat. So it's just kind of become the norm. A lot of angry people out there, and they take it out on public figures, unfortunately.
Is there a common trend that you're seeing with regards to the type of abuse that you were receiving or that your colleagues are receiving?
I could give you a list of favorite words, but most of them wouldn't be pronounceable on a family show.
So it's just anger.
Yeah, a lot of it's just anger. A lot of it is anti-government, being angry at the government, at experts. It's this rejection of expertise and of institutions. And, people feel, and not wrongly in many cases, they feel put down. They can't pay for their groceries. It's a hard time out there.
Yeah, and COVID was traumatizing too.
Yeah, and COVID did harm a lot of people, and not just disease-wise, but economically. We had good programs in Canada, but a lot of people fell through those cracks, and a lot of people are bitter about it.
Yeah. Can you talk a little bit about the reporting that you did during COVID? What were some of the more poignant pieces, the most difficult ones to write, and which ones brought us a lot of joy during a very, very dark time?
Yeah, I think for me as a columnist, it was really about giving people perspective. I think one of the things we did wrong as journalists during COVID is there was just too much stuff. There was just an avalanche or a tsunami of news.
So much.
And my job was kind of make sense of it. So the big difference for me during COVID is I wrote a lot. I wrote almost every day for 2 years.
Wow.
And there was never a shortage of material. I'd say if you asked anybody, my most impactful column was a column that ran just before the shutdown. And it actually, I don't do the headlines, but the paper put a big headline and saying, shut it down. Which was my message in the column, was that the time has come that things are spreading so quickly that we have to try and nip this in the bud. And I still get grief to this day about people who didn't like the lockdowns, they kind of blame me. But from a newspaper point of view, it looked impactful because of the timing. But I think to be fair, they didn't shut it down because of me. My timing was just good. I could see the writing on the wall.
Yeah,
And that's what I do. I articulate. I always say to people, I can say things they can't, the experts. So that's kind of my job, is to articulate the point of view of people who have expertise in these areas, and they can't always do it themselves.
I have a couple of follow-up questions,
Yeah.
but I'm going to let you.
Yeah, of course. Well, I'm really curious about, you've been in the industry for over 40 years. You've written about so many different things. You've used journalism to cover so many different topics, including the AIDS crisis. So I'm curious what the AIDS crisis has taught you about writing when people are scared, when people are fearful of uncertainty.
Yeah, the AIDS crisis is really the arc of my career. Like, I wrote my first story about AIDS in 1981, before it was even AIDS. We used to call it back then GRID, gay-related immune deficiency. So there's really this stigma. And I think AIDS, to me, profoundly changed the world.
Yeah.
And it changed medicine profoundly. It changed the media profoundly.
Absolutely.
So, before AIDS came along, we literally had a medical reporter who would read medical journals and talk to the experts, and that's what they reported, right? There's this, I remember poignantly to this day, I was lucky. I was a summer student. I was the bottom of the pile. So I got all the crappy assignments, right, as they were perceived. So my first summer at Globe, I covered many AIDS protests. So it was at a time when Rock Hudson had just come out. To me, that's the most monumental thing that happened in AIDS. Rock Hudson came out, a well-known figure, and said, people, was revealed that he had AIDS. Yeah. So that changed everything. But there was also no treatments at the time. There were no effective drugs. And there was a lot of infected people, a lot of angry, mostly angry gay men. But there were people who were very articulate. They were, they had good jobs, etc. This challenged everybody's perception of what this disease was. So I spent like a summer sort of covering protests of very angry men. And I think it shaped the way I've been writing for the last 40 years. So I don't write about journals, they're peripheral. The information to me is peripheral, but I write about people and I write about policy. Like I do lots of teaching now at journalism schools. I go visit, and I always tell the students that an ideal story, that's what it needs. It needs a person, it needs an issue/problem, and it needs a solution. Yeah. And that's what I try and do in my very short columns every week, is try and get those three elements in on whatever topic catches my fancy. But AIDS was really, really important for me and for many other people in the world.
Just follow up on that. Like, have you ever experienced someone kind of stirring you towards a specific narrative, or forcing you to write about something, or following a specific perspective? Because I'm just really curious what agency you have when it comes to your own writing, and whether or not you're influenced by other people.
Yeah, I'm lucky that I have a really long leash, so I can pretty well write about what I want.
Awesome.
The only restriction I really have is sometimes the lawyer will look over things if I get a little worked up. Okay. So there's that element. But the Globe is, I've been there. I've never worked anywhere else. Right. But one of the attractions, the reason people like working at the Globe, is it's a writer's paper. Right? The editors are not intrusive. They're intrusive on the, your grammar has to be right, your logic, but it's like it's your topic. Other papers have a different reputation where they're very editor heavy, and the editor tells you, here's what you're going to do and the order you're going to write it. Right. And we don't have that, thankfully. Like, even when I was a summer student, it was just like, go out there and do it. And, it better be good. And if it's not good enough, I'm going to send you back. But it wasn't, here's what you're going to do. Yeah.
I'm curious about your writing process, since you've been doing this for a while, and also the parallels between what you talked about when you covered HIV, AIDS, and COVID. But first, let's start maybe with the writing process. You talked about really capturing people's the humanness of people and people's stories. How do you capture their emotions? How do you get the stories? Where do you go? You've talked about writing every single day during COVID. What is your writing process like?
Yeah, it really depends on the type of piece you're doing. So now I do mostly opinion pieces. So I spend a lot of time sitting on my butt at my desk, and I talk to a lot of people. I talk to lots of people on the phone. And people always note, like, I very rarely quote someone in my columns for the reason that I said earlier, is I can give voice to people who can't speak publicly. So I always say the most important people in my pieces are not there, right? They're in the shadows, and they're feeding me information. So that's the way you do a column. I spend a lot of time doing research, and I write very, very quickly. I can write my column in an hour. Wow. it's formatted. I write exactly 700 words. I can almost do it on the first take after all these years, but then I fiddle with it for a few hours. But I've written columns in less than an hour that just start to finish, and they go right to the paper, like in big, breaking news times. That's not the ideal, but it can be done. Now, if I'm doing something like a feature, it's very different. You immerse yourself. Back in the earlier days of AIDS in the 90s, I used to go to Africa a lot, and I could spend a week in I didn't just write about AIDS. One of my favorite stories I ever did was spent a week in a sleeping sickness hospital in Uganda. And sleeping sickness is a very interesting story to write about because it has all this mythology and the treatments are horrible yet effective. So there's a lot, that's to me the ideal story. It had a lot of elements and good photos and the whole bit. So it depends on and then sometimes we do these series at the Globe. We do a lot of investigative journalism. Back when probably the biggest story of my career is I covered the Tainted Blood tragedy. And I covered that literally for years. Went on. And we do a lot of individual stories, but every now and then we'd step back and do a big take. Like you have to put things in perspective and here's an issue. So that one went on for years, but it was very, very impactful. We had the Crises inquiry, probably the most important public inquiries ever happened in Canada, because actually the recommendations were actually implemented, which is very rare.
Huge.
And then, the result of that, because I keep track, is there's been about $5 billion in compensation. So that a lot of people were harmed, but a lot of people were compensated. And again, that's a rarity. And, I'm not saying this is only me, it's not only the paper, because this thing snowballed. It got vast coverage, and that, it almost brought down a government. So these are big deals, but it's not any one individual. But somebody has to get the ball rolling. And I was just lucky enough to be in that space where, and the way that story came about was very, very funny. It was the editors, we often use these standard lines when we write about a story, and back then, HIV affects gay men. We used to say, and maybe I shouldn't say this in 2026, but we used to have a shorthand. We'd say the 4-H club. So it's hemophiliacs, heroin addicts, Haitians, and homosexuals. Right? It was just sort of a thing to, you guys use mnemonics in medicine all the time. That was ours. So we always had this little one paragraph. Here are the 4 groups affected. And my boss one day says, "You're always writing about the 3, but what about hemophiliacs?" Like, what? Well, I don't know. I guess they get blood. I guess that's how they got HIV. Well, why don't we look into that? So then a colleague and I spent a few weeks digging into it, and ended up being like the most amazing story we've ever written. And we realized after we had just sort of scratched the surface of it, but it was quite staggering. And the personal stories, I'm still in touch with people from the 80s who were infected. There's this grandmother I know. She's become a grandmother since. I know the exact day she was infected in 1981, because she happened to have, it's weird, she's a painter, and she had a painting with the date, and that's the day she got the call. So that's amazing. That's 40 years, 45 years. So
You must have, I'm curious about you talking about keeping in touch with her. Do you have this long kind of list of people that you've just met that you continuously check in on and kind of meet through your stories?
There's a few people that I've kept in touch with. You don't keep in touch with everyone, but I do go to a lot of conferences. I cross paths with a lot of people, and it's interesting. It's really fun to see. I speak with lots of med schools and med students, and it's fun to see. I met him when he was a med student, and now he's the president of a hospital. It's fun to see. It doesn't make me feel any younger, but it's fun. And there's people. We're writing a lot these days about GLP-1 drugs, and I remember that researcher Dan Drucker. I've known him for 25 years.
Wow.
I remember writing a little story about he's got this new thing that's going to help people with diabetes. And it's just a story that came and went. But again, I ran into him in conferences over the years, and then you realize, hey, this guy's a big deal now. But he's still the same modest researcher, loves his research, and has never made a penny off this gigantic discovery that's made billions for others. He hasn't made a penny off it.
Amazing. That's how it should be.
Yeah. But it's not the norm anymore.
No, it's not the norm. I wanted to ask you about something that you said that was so beautiful about capturing people who cannot necessarily speak up and capturing their stories. Can you speak a little bit about how you go about doing that, capturing their emotions in a way that makes the world see them without necessarily giving their identities away. Yeah, what is that? What is that like?
Yeah, I think the key is like, again, when I teach the students, I think it's just about listening,
Yeah.
which is not something we do in the modern world very much.
And
You might-
building trust, right,
Yeah.
with folks.
Yeah.
Yeah.
So just, having them, like I'm always humbled by how people open up and tell me their stories in a really, unfettered way.
Yeah.
And it's really touching a lot of the time. But it's about listening. It's about, I think the single most important thing we do if you're a good journalist is you don't judge. Right? And I think that's a big lesson I learned from AIDS. Early on in my AIDS coverage, somebody, was all this, there's a lot of anti-gay men stuff there. People wanted to put them in quarantine on islands. We want to lock away people, jail them. And I remember, and, some of the stuff, I'm, a naive guy from Northern Ontario, I don't know a lot of this stuff. And you're writing about, well, how do you get infected? And it's like, well, we went to the bathhouse and I had sex with 12 men. And you're like, oh. But then you realize, well, I'm not going to judge. And then, so, I guess I was doing an interview and somebody kind of, looked askance or something. And he said, come with me. So off I went, spent a night, following a guy around at the bathhouse. And it was fascinating.
Oh my God.
But you realize these are just, this guy's an accountant. These are normal people.
Humans
And
with
who are we
different
to judge,
experiences.
right?
Yeah.
So,
Wow.
so I think that's really the key, is to be open to anything.
Yeah. I have so many questions.
Please.
I was going to say, you've spent your entire career capturing other people's stories. So a bit of a side parenthesis and maybe a little personal. How would you like your story to be captured?
I'm really old school. I know this isn't popular these days. My students now only want to write about themselves, but I never, ever write a story in the first person. I've never done it. It doesn't interest me. Sometimes I'll do interviews and people ask personal stuff, but I'm like, I think journalism, in the way I operate, is you're not part of the story. You're there as a neutral, well, not necessarily neutral, but as an observer. And trying to give voice to the voiceless. I'm not voiceless. I don't need the help. Right? So I think I'd rather spend my precious space talking about other people than myself. But that's very different today. We live in the selfie world, and that's
Selfie world, yes.
that's after my time.
Yeah.
I just don't. Like when I talk to my students, they're always like, oh, I have this story about my mental health crisis. And they say, great, what's your second story? Again, I don't really care. Well, and it's not that I don't care about you, but it's not that interesting, right? Go find somebody interesting to write about. Find a Holocaust survivor if you want a real story, and why are they still alive?
Sure.
Very interesting that you talk about, the selfie world. And I mean, I'm a 90s
Are you
kid.
part of the selfie world?
I'm trying to be. Yeah, I mean, I grew up in the cusp of being a millennial and Gen Z. And when I was growing up, we had access to traditional media. I would go on the subway. I would have access to the newspapers in the
Yeah,
subway,
same.
read them, rip out coupons. But now,
Cartoons were my favorite.
literally. And the
Get that?
crosswords on the back.
Yes, those were my favorite.
But now I feel like we're shifting obviously to everything's digitalized, everything's on our phone, right? And I think there's a lot of issues with that. One, we're consuming so much media so quickly, which is the swipe of our phone on TikTok and Instagram. I'm curious what your thoughts are on desensitization of media, and particularly youth who are constantly being exposed to all of these different atrocities and whatnot through our phones, and they don't necessarily have the motivation to act anymore because it's just another day in the life. So what are your thoughts on how journalism can maybe kind of fill in that gap, or what the impact of these platforms have had on journalism?
Yeah, I think I try to not be an old guy who's judgy about younger people. The reality is I've lived a lot of technological change. I've tried to adapt to it, and a lot of it is good. I don't think we can... the internet changed the world, it's changed journalism, it's democratized media. A lot of that is good. What worries me is just that people don't know the news anymore. Like, I don't really, shouldn't tell my bosses, but I don't care where people get their news, but I really wish they would get news.
Yeah.
And when I'm sitting on the bus and I'm watching somebody in front of me just
Scroll
a
and
nanosecond per story,
Yeah.
just flipping through, I'm like, you don't know anything.
Yeah.
You don't have any information about the world. So it doesn't have to be the Globe and Mail. It can, TikTok can be done well. Whatever's coming after TikTok maybe we can do it better. But to me, it's just like be engaged in the world.
Yeah.
Last week when I was at the University of Ottawa, and I went out I was at a conference, I went during the break, and there's a beautiful lounge, and it was silent, and every single student was sitting there on their device, and I was like,
Guilty of that.
that is the saddest thing I've seen in a long time. I was like, I can't believe it. They don't engage with each other.
I've noticed that in public transit,
Yeah.
where everybody's just on their thing, and you're just and nobody's looking up, and I'm looking up, and I'm like, even if you just smile, there's science around that, right?
Literally.
If you get a smile from a stranger, it kind of makes your whole day, and you
Yeah.
pass it on and whatnot, and you create this like collective good at a time when we really need it, but everybody's just scrolling, and I'm definitely guilty of that too, but I'm trying to do less of it.
Yeah.
On the bus, I spend my time staring out the window because almost every day I go to the downtown east side, and it's always like
That's on the east
humbling.
side. Oh,
Yeah.
okay, in Vancouver.
Vancouver, yeah. So
Okay.
it's very humbling to see what's going on.
Yeah, yeah.
And then it's like, I wish people had an idea what was going on
Yeah.
rather than, whatever the latest, whatever they're flicking, I don't know.
Yeah, yeah.
Has there been any sort of conversation within the newsroom or just amongst other journalists of adapting the way that they, write to consider these different platforms? Because I personally don't think, TikTok or Instagram are going to go away, or they have their own purpose. But because, you've consumed so much of their media through there, is there a way for journalists to adapt the way that they write or adapt the way that they output their media to kind of fit to these platforms?
Yeah, our writing has changed dramatically in the internet age. So stories are way shorter than they used to be, less than half what they used to be, because we know that people have a very short attention span.
Yeah.
So there's a shortness. Even platforms like the Globe, it's kind of old-fashioned, an older audience. We delve into TikTok and things like that.
Right.
Instagram Reels. I personally don't do them, but the younger people do.
Yeah.
But, we have to adapt to stuff. We can't just poo-poo it.
Yeah.
But I think hopefully use it well.
Yeah, yeah. And I think, but I'm kind of on that same note, like mis and disinformation. It's a huge topic that we talk about, and especially when, again, we're consuming so much media so quickly. What are your thoughts around, the integrity of these platforms? And tech democracy is a huge conversation happening right now. What are your thoughts around whether or not we should have content moderation or Meta is another thing as well? So like, what are your thoughts around, just the overall kind of consensus of, the use of platforms and the moderation of them?
Yeah, so I'm a journalist, so I tend to err on the side of openness. Like everybody should have an ability to speak.
Yeah.
And that's what I like about the internet. It has given people more voice. It's not just the Globe landing on your doorstep, and that's the news of the day. People have other ways of learning stuff. So all that is good.
Yeah.
I think what's unfortunate is that this has been exploited, and it's been exploited for financial and political gain.
Yes.
And I don't think people understand that enough.
That's right.
Newspapers used to do this. Newspapers used to be very partisan.
Yeah.
Like I've just lived through this very odd period in history where newspapers were kind of supposed to be neutral. And it wasn't the case for since the Gutenberg press for the first 200 years. It wasn't that.
Yeah.
And it's not going to be that for much longer.
Yeah.
We lived in this weird bubble. So I'm a big fan of history and medical history. So I think contextualizing this stuff is important.
Absolutely.
So the other part of context for misinformation for me is to realize it's always been around.
Yeah.
Right? Like I'm going to say it jokingly, but it's not a joke that, the day after Jenner used the first vaccine for smallpox, I don't doubt that there were people in his yard with placards, right?
Yeah.
Yeah, of
Because,
course.
you did this to a child, you put dog stuff in him, like you're evil, you're a devil.
Yeah.
And I often tell the story, the anecdote of, in Montreal, there was a huge smallpox outbreak in 1905, the biggest one in the world. 20,000 people marched against vaccines. The population of the city was only 100,000.
Yeah.
So we don't have that problem today. Imagine if 20% of Toronto had come out during COVID and protested vaccines. It wasn't. It was 60 people
Yeah.
with a very, particular point of view on the world. So I'm like, hey, I'm glad they're protesting. I think we should have the greatest variety of voices, but we shouldn't lose sight of the fact that, we write a lot about vaccine hesitancy, et cetera, and we tend to be dire about it. But I always kind of mention in passing, about 91% of kids have their vaccines, right? That's a good thing.
Yeah.
And we should, I think those of us who believe in it, the mums who get their kids vaccinated, they should speak proudly and openly about that. I think that's a big part of the solution. I don't think it all has to be big campaigns, and the media is not going to change people's minds.
Right.
Their peers are. their neighbors are and their sisters and, and aunts. That's what matters. And so we have to find a way of getting to them.
Absolutely.
I have a follow-up question on that. We chatted about this a little bit yesterday, just the idea that information sources and the ways that people are getting access to information is changing. Joe Rogan keeps popping up. And so just thinking about, I really appreciate what you said about, we shouldn't be censoring. We should just let everybody speak up. But also the idea of certain folks exploiting that for their own financial and whatever gain. So when you have someone, I won't name names, but someone who's like incredibly anti-vax, childhood vaccines or whatever it is, and that's being platformed in a platform like Joe Rogan that has millions and millions of followers, what would you suggest is a good approach there? Is it having somebody else who with the right expertise to have a dialogue with them, but are they even open to that dialogue? So how do we navigate all of this?
Yeah, I think that's hard. I think ideally we should have the dialogue, but
Yes.
it's never going to be a fair fight, right? If you're telling untruths, if you're telling lies, that's easy. If you want to be truthful, it's much more subtle. It's not
Nuanced.
complicated. So it's not a fair fight.
Yeah.
But I think you have to, if somebody says, I'm going to stop my kids' vaccines because I heard on Joe Rogan, you say, well, you should think twice about that because it's what I read and that's why I get my kids vaccinated. I think you just have to do it one little bit at a time. And just on the, I do believe in free speech and erring on the side of free speech, but there's some things we can't allow, right? You can't, the classic, you can't yell fire in a theater because it's danger.
Yeah.
And that's what I don't like about social media. Like
There should be some guardrails.
my guardrail I'd like to see in social media is it actually be treated by other media. So I work at the Globe. We're a publisher. If I write something outrageous and get sued, it's the paper that's responsible. Right? The social media platforms don't have that. The social media platforms just say, "Oh, it's not us; it's somebody else saying it." But you're giving them the bullhorn, so you should be responsible. To me, that would end the vast majority of stuff very quickly. The other part is I'm not a big believer in anonymity. Why?
If you're going to speak up.
Say
And that's why I say to people, you're full of it because you say this. And I said, at least I say it in my voice. You know who I am. You're X3964 on Twitter. Who do I know? You're probably a Russian bot. For all I know, right?
Yeah.
So I think that's the stuff we have to crack down on. There's that anecdote about the day that the Russia invaded the Ukraine.
Yes.
They were cut off Twitter, right?
Yes.
And the abusive stuff fell by about 90%.
Yeah. That's right.
Like
That's
we know it's bots and stuff, and I know this stuff. Like when I write on certain topics, I know I'm going to get flooded with stuff, and it's very predictable and it's very formulaic. And why do we tolerate that? I think that's what we need to legislate rather than people's viewpoints.
I'm going to just ask a small follow-up question on that. I know a lot of folks have left X, for example, because of what it has become in recent months, years. Can you walk us through a little bit about your decision of staying in it and perhaps the need for more diverse voices to exist in all of these platforms?
Yeah, so I waver on. I was big into social media for a while. It was important to me during COVID to share stuff.
Yes.
So I was on what was then Twitter. Now what I've stopped doing is I don't engage anymore. Twitter is really great at the beginning.
Oh, it was amazing. I used it all the time.
You could talk to anyone. The best scientists in the world, you could
And you had
post and you might
access.
respond.
Yeah.
So that was the real democratization. But then it got perverted by all these bots and people selling stuff and selling nonsense. So now what I've done is essentially I'm disengaged.
Okay.
All I do on Twitter now is I essentially post my columns.
Okay.
And why do I waver on that? Should I do it? People give me grief over it. And I'm still like, I still have like 150,000 followers. So I might as well share my stuff. And, if I get abusive responses, I generally don't see them because I just post.
We just
and
post
leave.
and don't engage.
But, so now I've moved over to Blue Sky, but it's much smaller numbers. But the people, they tend to be real people. So I don't
Always a
mind
good
that.
thing.
And actually, my social media of choice these days is LinkedIn.
I really appreciated LinkedIn as well. Yeah,
Because
come a
what I
long
like
way.
about LinkedIn is essentially your bosses are watching you, right?
Yeah.
So people are well behaved. I can count in 15 years of LinkedIn, I think I've got 2 insults. Like I get that every second on Twitter.
Oh, yeah.
Yeah.
So, people are just careful. And actually one of them, I saw blah, blah, blah works for such company, and it was so obnoxious that I actually wrote their boss.
Wow.
And I said, do you know that your employee is doing this on office hours? I never got a response, but, hopefully they read it. And that's
There is that accountability.
Yeah.
there has to be there's no accountability, Jen. But you can't be anonymous on LinkedIn.
No, that's right. That's right.
Can you maybe help us discern a little bit more the differences between evolving uncertainty and misinformation?
Yeah, so uncertainty is a normal part of science.
Yeah.
And I think again we don't do a good job of that in the media, of contextualizing things, saying, this is what we know, but the but has to be in there. But you have to do the catchy thing to get people to read it, but you have to have the but in there. Misinformation is people believing and repeating untruths and lies. Most of that is not malicious. I don't have a problem. Misinformation makes me sad, but I don't think it's a huge problem. Since people who are, especially for me, it's all about vaccines in my world. So most people who are vaccine hesitant they love their children. They don't want to do any harm. These are not evil people. I'll engage with them happily. Say, I'm sorry you think this. This is what, like there was one the other day, I had an exchange about someone who sent me, oh, well, you should read this from Children's Health Defense. Right? And I said, well, thank you, but here you read this about Children's Health Defense. I think you should know that they're
Who's funding them, what they're doing.
they're in the business of getting your money, right? Not the health of your child. So I don't mind interacting. Then the one that really worries me is the disinformation. It's like people spreading falsehoods for political and financial gain. And that's the real troublesome one. And there are people making billions of dollars off this, and that's the discussion we have to have.
Yeah.
Every well-meaning mom who's withholding vaccines has to know that somebody's ripping you off, making money off your pain and your suffering. And that's how we have to phrase it. And we have to be very relentless about that.
Yeah. Sorry, I just wanted to ask, how's the globe handling all of this? Is there a strategy for combating the disinformation?
We talk about it all the time. We try, our stories are written differently now than they used to be. We used to have a lot more of the he said, she said. We're kind of eliminating a lot of the baloney. We're not giving them voice and platforming, and I think that's important. The other part is we do a lot of debunking. So we have a journalist who does just that. Like, here's a big story, and every day he says, here's what's said in social media, and here's why it's wrong. Here's a source you should read. But again, you can't keep up, right?
Right.
So I noticed that in La Presse, the Montreal paper has one now every day where it just has a picture and it says false, right? Something from TikTok or Twitter, and it says false, and then it explains why. So they had one yesterday, there's a picture of Justin Trudeau and Katy Perry, and they weren't.
Have comments about this?
Yes, no, they weren't at the Grammys, right? It was this fake photo saying they were at the Grammys, but they actually weren't there. So here's the fact. So,
Oh my gosh. Interesting. I want to so going back to mis and disinformation, my understanding is disinformation has this intent to harm, right? So this intent. How do we figure that out? Because it seems so overly subjective. How do we identify that there is an intent to kind of, find the differences between mis and disinformation?
Yeah, I think sometimes it's hard, but I think it usually, follow the money is always one of our mantras in journalism. I mean, follow the money, you figure out why a lot of this is happening. There's the story, there's a great a report called The Disinformation Dozen.
Yes.
That really outlined, these 12 people are responsible, I think it was for
75% or 70%.
70% of all the false vaccine information in the world.
Yeah.
And then, I remember writing it, I called them and I listed all 12.
Yeah.
Every one of them is very rich.
Yep.
And they all get rich selling quackery.
Yeah.
Right.
So that's, again, it's about being informed.
Right.
I think if more people knew that, then perhaps they would question.
Maybe think twice.
About accepting their information. I wanted to ask you, I was just so taken by the story that you shared earlier about the bathhouse and whatnot. Can you talk about some of the I don't know if it's the best, but the most compelling stories. I'm sure you've covered so many, but what are some highlights that you reflect on or think about quite a bit in terms of stories that you've covered in your career so far?
Yeah, to me, the compelling stories are the ones that we have a human element
Yeah.
and that have an impact. So one of the most touching stories I've ever done was actually about a woman, and I got an email, and I get lots of email that comes and goes, but this one I'll always remember because it said, the first line was, "I killed my baby."
Oh.
So that gets your attention, right? But
Yeah.
it was about a mom, and she had given birth, and she was in a hospital, and the baby was with her, and she rolled over, suffocated the baby.
Oh, good God.
You know, she's exhausted,
Of
18
course.
hours labor, etc. And so she approached me like, "I read your column. I want you to tell my story." And I was like, you know, so I was like, my first reaction is like, this will be a great story. But then I go, you got to think about this. Because if I write this, you're going to get some really ugly
Really?
hate mail,
Yeah.
right?
Yeah. Yeah.
And I feel uncomfortable with that. You've already suffered enough. And then I worried about her mental health, and I told her that.
Of course.
And so I said, so I asked for permission. Can I talk to your, like, she said, oh yeah, I'm getting counseling. And I said, can I have permission to talk to your psychologist? And then I said to the psychologist, if I do this, is it going to cause her harm? Right? So I did sort of all my due diligence. And he's like, no, I think it's going to help her.
Wow.
And I ended up doing a story, and it was a very touching story. But what really was touching is that within a week, there was a new, I guess it was a recommendation, not a rule, but a recommendation from a pediatric society saying there should be no co-sleeping in hospitals, right? And she was so happy. Like, this is the way I'm honoring my son who died, right?
Yeah.
So those are the ones you remember. There's another story going back to the AIDS, which I wrote about in a book once, where I was assigned to go meet someone who had called into the Globe and said, this was in the very early days, one of the earliest stories I did at the Globe, and he called in and said, my partner's in the hospital, he has AIDS, and they're treating him horribly. Like, they don't bring his food, they don't change his bed. Like, he was just essentially treated like a pariah, right? So my boss is like, go off and see the AIDS guy, go right off, go meet him. So I went to the hospital, it was just in downtown Toronto, and I walked in and I introduced myself and I shook his hand, and he burst into tears. He said, no one's touched me for a week. I've been in hospital, no one's touched me. Like, why are you touching me? I'm like, well, you're just a person, I introduced myself, and they told the story. They had put a nuclear, radiation danger sign on his door.
Oh my
so people wouldn't
goodness.
go in. They put his food trays at the door. They wouldn't bring them in. They hadn't changed his bedding for a week. So, I just wrote this very factually. It wasn't a particularly touching story. It was like kind of an angry story. But this is before the internet, the paper lands on people's doors at 5 a.m.
Yeah.
By 8 a.m., the hospital was calling with a press conference to say, oh, we're bringing in new rules about, that's the stuff that you remember is when you have an impact.
That is so powerful.
And that, I'll say the hospital, it was horrible at the time, but St. Mike's Hospital, because it's become a leader in the world for treatment of AIDS care. So it's the little things that really change.
Everything.
And, the most outraged people were other employees. Like, how dare you treat a patient like that, right? But at the time, it was kind of the norm.
Wow.
So those little stories, and you rarely know which ones are going to have an impact. Like, I've done stories where I'm like, oh, this is going to be amazing. And nothing, barely a comment in the comment section. And you're like, oh, well.
Yeah.
Better luck next time, or whatever.
Yeah.
Can you maybe take us to the day where you were in the room when the first Canadian was getting the COVID vaccine for the first time?
Yeah.
What was the energy like in the room, and how did you feel that Canadian media coverage changed since on the pandemic since that day?
Yeah, it wasn't particularly a touching event.
Yeah.
It was very bureaucratic, and we were very far away because of risks of infection. Yada. So it was like a photo op. So it wasn't that interesting. Like, I don't usually go to photo ops because it was about COVID. But yeah. So these things, those things happen every day, and they're not usually interesting.
Yeah.
That one is just like a footnote in history. I forget her name, but
Awesome.
yeah. So Yeah, so some, that's the opposite. Like people think, well, that must be an amazing story to be there. And you're like, it's like it's like being at these political events.
Yeah.
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 This is
Cutting the
before my
ribbon
time,
and
but
all
sort of
that.
there's a famous Quebec story, the Night of the Long Knives, where the premiers betrayed each other.
Yeah.
And like that stuff's boring. You're just sitting in a hallway for hours and hours and hours, right?
Waiting.
Yeah.
So it's not always as it's not as fun as on TV.
Yeah.
There's lots of waiting and doing
Oh.
nothing. So.
I wanted to talk about just generally more speaking, and Pearl is, we focus on emergency preparedness and recovery, and just thinking about coverage during crises. So you mentioned that you teach in journalism schools and to journalism students and other students as well. What do you tell them about coverage during crises?
Yeah, I think you have to keep your eye on the ball. So I've done lots of things like, go off and I was in Rwanda during the genocide and then went over to what became DRC, Democratic Republic of Congo, and covered I remember one of the most striking stories of my career was going to this, essentially a cholera camp. So it was a refugee camp where cholera was just spreading like wildfire. Like 20,000 people a day were dying. It was just, and they were just literally loading them up in dump trucks and putting them in pits. And so that's stuff you remember, right? But you just have to keep, what's the story there? The story is these people are dying because there's a war, because they have to flee, you have to try and... So I think, first of all, stick with the facts. Try, keep yourself safe. It's really practical stuff for when you do disaster coverage. The big one I tell people is, I'm a big fan, I don't know if you know Peter Sandman. He's sort of this professor who's sort of the guru of crisis communication, right? And he has these rules which are just brilliant. But the one I always remember is never tell people not to panic, because that's the only thing that makes them panic.
Of course,
right?
yeah.
But that's the thing I remember the most when I go to disasters. Is it's not like on TV. It's eerily quiet. People are super calm. I remember being in this cholera camp, and the people are just dying all around you, and everybody's just like, I'm going to get my bowl of soup. Life goes on. Right?
Yeah.
So it's that people don't go running hysterically. It's, again, during an earthquake or a hurricane. I've been at those things, and people are just like, you get through the day, and where's my child? And it's all practical stuff, right?
Practical stuff.
So, so I think, try and give a fair representation of what's going on.
Happening. Yeah. I had one last question, and then I'm going to hand it over to you. I was thinking about crisis in general and what happened. I know you've done both coverage domestically, but also globally, and you wrote a book, Neglected No More, which was just, I read it, and I think I was in tears the entire time just to see that this was happening here in Quebec. Can you talk us through the long-term care, long-term home crises, and if anything has shifted since then, and if we're even prepared for the next emergency?
Yeah. So this is an offshoot of the COVID crisis.
Yeah.
And people, again, I don't think the public recognizes this, but people who were most harmed were older people. This is a virus that really struck the vulnerable, very different from the 1918 pandemic, which affected young people.
Yeah.
So huge numbers of people died in institutional care, so in long-term care homes and nursing homes to a lesser degree. And I think we just forgot that.
Yeah.
I can't tell you how many emails I've gotten where people saying, well, they were going to die anyhow. Why are you writing about these old people that are going to die anyhow, right? And it's not true. So I'd say, yes, there is a high death rate in long-term care homes. It's about 1% a month. But during COVID, it was 20%, 50%. There are some homes in Quebec where 60% death rate in a month. We've never seen anything like that ever in healthcare in Canada. So in my book, called this a massacre of neglect. It was essentially neglected in Quebec. People died of starvation and dehydration in state-funded institutions in 2020. This is unconscionable. And I think we have to talk about that much more openly. And sad, I did this book sort of very quickly during COVID. I was super busy, but I thought, to me, it was an opportunity, right? I've been reading about elder care forever. It's because who gets the vast majority of healthcare? It's old people. It's natural. We do a terrible job of housing older people, etc. So to me, this was an opportunity to write about these issues, and COVID being the launching point. And my thinking being, and COVID's going to change everything, right?
We all thought that.
How can we not, it's been 60,000 COVID deaths in Canada, about half of those in this very small 2% of the population, right? 30,000 dead. We got to act, right? But what's happened? Essentially, we've done more of the same. Like, it's the worst response imaginable to me. The response has been, let's build more big nursing homes. And big is not good when it comes to infectious disease, as you guys know very well. These viruses, it's an airborne virus. It spread like wildfire.
Yeah.
We had staff working in multiple homes. They were vectors through no fault of their own.
Nope.
Don't blame them. We have underpaid workers, a huge turnover, not trained. Everything you can imagine being wrong happens through our elders in
And the
institutional care.
privatization.
Privatization, the cost. People naively go through life in Canada thinking somebody's going to take care of me. It's part. I have free Medicare. I'll be taken care of. It's not covered.
Yeah.
It can cost $2,000 to $15,000 a month to live in a nursing home. And those two, by the way, are pretty well identical. The 15,000 one just has nicer drapes and chandeliers and food, but the care itself is about the same.
It's about the same.
So I think people have to know this. You read the polls, everybody wants to live at home as they age, but our system's not built for that. And for many people, it's not
It's
realistic.
not possible.
Yeah. So we have to, to me, that was a really sad part of COVID, is that we just didn't learn.
Yeah.
And if it happens again, it's like everything else with COVID. I think we're less prepared,
Yeah.
and the next time is going to be much worse.
Much worse.
And hopefully I won't still be alive then, but if I am, I'll be writing about it in some way,
Yeah.
at least in the early days, issuing some warnings, but not sure they'll be listened to.
I mean, with, preparedness, I want to build momentum. It's always about building momentum and building that motivation to kind of continue and build that resilience. So with that, you talk a lot about not about looking at the past, but looking into the future. So what advice do you have for public health workers and journalists to do exactly that?
Yeah, I think it's really hard to do because, especially in healthcare, there's so much that needs to be done. The pressure is to do what needs to be done today, not be ready for tomorrow. So we have this pattern. Every healthcare crisis we go through, SARS was a classic one.
Yeah.
We had SARS. We built up this great public health agency of Canada. We had these great warehouses full of masks, etc. And then we just let them rot.
Yeah.
And then we said, why are we spending all that money?
Yeah.
We could be spending it on, clearing out emergency rooms. So then we stop. And then, lo and behold, COVID comes along and we're like, we have a warehouse full of rotten masks. Like, what? So we have to panic. We have to buy it. It's just we don't see it has to be an economic argument. It's a
Yes.
good return on investment in
Absolutely.
prevention,
Yeah.
but it's a hard sell.
It's a hard sell.
I've been writing about this for years. It's the ultimate paradox of public health.
Yep.
When you're successful, you're invisible.
Nothing happens.
Yeah.
Yeah.
And it's hard, and for journalists, it's really hard to catalog something that didn't happen. It's much easier to catalog the disasters.
Yeah.
Yeah.
But we never seem to learn that lesson.
Maybe we should have a journal, or maybe the Globe can have just positive news. People can see all the good that public health has done.
Yeah.
You were drinking clean water today because of public health. I don't know.
That's been talked about forever. People always promote this idea, let's have a positive paper, and there have been many published over the years, and they always fail in a spectacular fashion.
Why do you think that is?
Well,
People don't want to read happy news.
well, people want to know what's going. They want to know what's going on in the world. They want to know
Yeah.
how to protect themselves. They want to know that people are doing worse than them. There's some kind of a perverse view of that.
Yeah.
And I think the attitude. My first boss at the Globe used to always say, we were young, naive, and we'd pitch all of these positive things, right? And he'd say, the sun rising isn't news.
That's the most beautiful thing.
Yeah, but his view is like, that's our job is to be a watchdog. It's not to tell. He said, my boss said, of course it should work. That's why we give them the money.
Yeah.
Of course it should work.
Yeah.
We write about it if it fails. And I think, unfortunately, we still have that attitude. I think it's a little different. We do a lot of positive stuff. We do some, I talked about Dan Drucker earlier. We did this lovely profile of him and this amazing work he's done. GLP-1 is just one little part of his career. He's done amazing things for people with diabetes and obesity. And, so that's really positive stuff. But
Yeah. Well, Al, do you have any last questions? And then I have a last question for André.
Please.
So good. We actually wanted to ask you a personal question. So we hear that you are a new grandfather. How do you think becoming a grandfather has changed how you think about being more hopeful about the world, being more prepared about upcoming crises? How has that shifted the way that you report?
I don't think it's made a huge difference, but it's more fun than being a parent because you just have the fun stuff and then you
Yeah.
turn them over if they're
Yeah.
trouble. So there's that. I think it's made me reflect more on the future, if anything, like what kind of world is my grandson going to live in, right? I know because his mom's a doctor that he's going to get all his vaccines, but what about kids he goes to school with?
Yeah.
And what about, is he going to have to walk down the downtown east side and it be full of people lying on the sidewalk, who are overdosing? Like what? So I think about that more. Like what kind of world is he going to live in, and how can we ensure that generation has a better. That's the goal ultimately, right? Is you always want your children and your grandchildren to do better than you,
Of course.
and that's not the case anymore in much of society. So we have to figure that out. And the flip side of it is I actually, I do have a lot of positive. I'm very positive about the younger generations. I think they handle, they grew up in social media, marinated in social media, and they understand it better. Like, my kids and their generation, they all have like private accounts. They're very careful. They're much more savvy about misinformation. And, boomers are the worst, right? I'm vaguely almost a boomer, but we're the worst. We share all kinds of nonsense because we're gullible. And these kids are much more, sadly, to the point of being cynical, which is sad. But I think they have more doubts and they're more careful. And I think all that's going to be good. I think they don't, they're not obsessed with work like my generation. Like there's a lot of good in the young people, and they take climate change seriously.
Yes.
So they are going to change the world, but I hope they can change it quickly enough and deeply enough and sort of snatch the world away from the billionaires who are in charge these days. That's the saddest part of our world, I think, is how a small number of people have so much power and so many are harmed by it.
Right. Well, Al, we're looking at you to solve all the problems.
For sure.
But Andre, thank you so much. This was such a delight to have the chance to chat with you one-on-one. We know you're so busy, so appreciate you making the time for us here.
No, thanks for listening to me babble on.
No, this was wonderful. Thank you.
Thank you.
Thank you.